All right, I hope everyone was able to grab a cocktail and some food. And I want to thank you all for coming tonight and wish you a good evening to everyone who has come and taken some time out to be with us. So that is our NHPA board members that are in the crowd today, which we will share a little bit later as we get through the presentation. So welcome to the National Hispanic Pharmacists Association's 7th Annual Conference. We're excited to have you tonight, and I am thrilled to be able to be up here and present to you as the president of the National Hispanic Pharmacists Association. So my name is Lisa Marie Serrano. As I stated, I am the president, happy to be serving this organization as well as the community. So as I stand before you, I'm really proud. I say this every year about the community that we have created, not just what's in this room, but across the nation, and this community where, I stood up here last year and I shared some personal experiences with all of you. I shared about how my family is descendants of farm workers. I also shared what my upbringing was like and my pathway to pharmacy. And I also shared about how it was very important for us to be able to connect with the Hispanic community to build our trust and relationships with them. And with that, what I've learned is there's a number of us out here who is focusing on our mission, which is to empower Hispanic pharmacists and other members to improve the health of Hispanic populations in collaboration with public and private sector partners, with our vision to be the leading pharmacy organization for improving the health of Hispanic populations in the United States. And so what I've come to learn is that I don't have this experience by myself. There's a number of us that are in this room that share the same experience, and so much so that we have had over 850 members since our founding in 2016. We've also helped to impact just over 200 Hispanic community members with our community events annually. We also have educated over 150 healthcare professionals with our continuing education series. Of course, we have to thank our corporate sponsors, CVS Health, Walmart Health, Pharma, Walgreens, and our new partners with Pfizer. We couldn't be doing this alone. We need our corporate sponsors' support as well as everyone in this room's support. With it, this is how we exist. This is how we grow. And most importantly, this is how we transform prioritizing the health of Hispanic patients. So at the start of this year, NHPA made a commitment to hone in on an area that continues to be an area of need. So this is to bridge the gap in vaccine confidence among the Hispanic community. I do want to share a disclaimer before I jump into the next few slides. The following is an unbranded medical presentation and is not intended to promote a Pfizer product or products. Any reference to a particular product or disease state is for illustration purposes only, and really to share why this is such an important initiative for the National Hispanic Pharmacists Association. And also, continuing medical education is also not associated with this presentation. So now that I got that out of the way, as clinicians, we know the importance behind vaccination and the impact in marked declines of the burden of disease associated with these types of illnesses for those who are directly vaccinated as well as indirectly vaccinated. What I can tell you is the COVID-19 pandemic has highlighted and really ignited the disparities in vaccine acceptance in the Hispanic communities. According to a 2021 study done by the CDC, they showed that Hispanic adults in the United States have consistently reported lower vaccination rates than their white counterparts. We know that vaccine confidence across the spectrum is highly influenced by informational sources which are shaped by knowledge, beliefs, and behaviors. The role of transparent communication could be really challenged by communication that is confusing to people, or if there's technical scientific knowledge that's imported into this communication, it can bring uncertainty to the discussion. And with many competing sources of information, it's really hard to determine the accuracy of all of the information. So what we do know is that the environment of information is coupled with attitudes and beliefs of the individual. And in addition, trust plays a significant role. This could be trust in the science, it could be trust in the provider, it could be trust in the information they are receiving, or it could be trust in the system as a whole. So all of these are contributing factors that we need to improve vaccine confidence, and they're present in the Hispanic community, but we believe they're amplified. A study published by the Journal of American Pharmacists Association found that vaccine hesitancy among Hispanic patients is often rooted in concerns about safety, side effects, but most importantly, a lack of culturally relevant information. So cultural factors such as the importance of family, strong community networks, and varying levels of familiarity within the healthcare system can impact vaccine acceptance. So many individuals in this community may also be hesitant to engage with the health system that they perceive as unfamiliar or untrustworthy. So it's important when we embark on this vaccine confidence effort to focus on the socio-psychological determinants of vaccine decision-making. So with that, for NHPA, we're really gonna focus on the area of trust. And this is where our organization comes in. NHPA, along with Pfizer, and along with all of our other corporate sponsors, we are going to embark on preparing our pharmacists in the opportunity to make a meaningful impact in this area, to move the needle in bridging the gap in vaccine confidence among Hispanic patients, and to develop trust with our patients. We're gonna do that in a variety of ways. The first is to build trust through culturally competent communication. So this includes overcoming any mistrust that individuals will have towards the healthcare system, creating information that's culturally competent and appropriate resources in Spanish, using culturally relevant examples to where the patients feel heard and understood. Secondly, we're gonna engage in community outreach. We have already sent a call to action for our students. And if there's any students in the room right now, we want to engage you in this effort as well. We are asking them to partner with their community members, religious organizations, and other trusted institutions to create community events to focus on vaccine confidence. So lastly, collaborating with our healthcare provider partners, pharmacists, NHPA members, and future pharmacists to align in consistent, unified, and culturally specific messaging for our Hispanic patients. So we as pharmacists are positioned to make this impact, but we as NHPA are positioned to lead in this effort to bridge the gap in vaccine confidence in the Hispanic community. We are going to focus on those that are vaccine hesitant as well as late vaccinators. We want to move the needle and push them towards the green zone of being acceptors. So our efforts are really going to be stemmed in this root of this organizational chart. These are who makes up the National Hispanic Pharmacists Association. Many of them are in this room tonight. Maybe what we could do, if we could just have those raise your hand so we could identify those who are part of the board of directors. So please take a look around. I would love for all of you to engage with them tonight to ask about what 2025 looks like for us, what this vaccine confidence initiative looks like for us. We just had a very insightful meeting just before this where we talked about our goals and how we're gonna roll this out for next year. I do wanna take a moment to say that you will see some vacancies that are listed on this chart. And so we ask if you're interested, we would be welcoming to have you be part of our leadership team and embark on this journey with us. So we have an exciting year ahead, and we want to continue to strengthen our partnerships that we've created. So our efforts to provide culturally competent care, removing barriers to access, and building trust with our Hispanic patients will provide them the opportunity to protect themselves and their loved ones through vaccinations. So right now, I want us all to commit to being champions of health equity and vaccine confidence in our Hispanic communities. So together as pharmacists, and NHPA, we could bridge this vaccine confidence gap. So I really challenge you all tonight to leave here and think about how we could all be partners in this effort. And so I do want to take a moment to thank Dr. Elena Rios. She could not be here today, but I don't know why that went to me. That was very strange. But I am not Elena Rios, but she could not be here today. And we really want to thank her for continuously making sure that NHPA is heading in the right direction. She helped us found NHPA back in 2016, and she is really, our beacon of light for every meeting that we have and making sure that we are connecting with our corporate sponsors as well as making sure NHPA stays on the map and expands. So next, I would like to bring up Debbie Perales, who is most importantly our president-elect, to share our region chapter highlights. And I thank you.
Okay, ooh, I'm tall for one, so we are being up here. So thank you all for being here. I want to say thank you to Pfizer, CBS, and my Walmart family for being here. Oh, and my Sam's family too, Walmart and Sam's. For being here. So like Lisa said, I'm the president-elect. I've been part of NHPA since the beginning, since 2018. And I'm really happy to be a part because the organization really aligned with Walmart, right? Want to make sure that we take care of our patients, right? So that they could save money, so that they could live better. So I think it aligns with what we're trying to do here. I've been a pharmacist for 25 years. 23 of those with Walmart, right? So that's really like all that I know. As you could see, English is not my first language. I was born and raised in Puerto Rico. I did pharmacy school there, and I actually moved to Florida because at the time they were looking for bilingual pharmacists, right? So that was my opportunity. I never thought about leaving the island. I just did for that opportunity, right? And this is, where I'm at. Walmart has been good enough, that I've been able to move and to, have different positions, staying with the same company. I was even able to go back to Puerto Rico and work there for 4 years. And then I've been back in Florida, now have a region that covers the whole Southeast. So it's been really special for me to kind of see the needs. I think in Florida, we're kind of blessed in having a good number of Hispanic pharmacy students and pharmacists. But just seeing that that's not the case, right? As AJ could tell you that when he went to California, he was surprised that I'm in Cali and there's no, Hispanic pharmacists in his market, right? And he was able to change that, and now he has a good pipeline. Now he's in New Jersey, so hopefully he'll be able to to do the same. And I think the contacts and the people that we met here in NHPA has helped with that. So we're really grateful to have all of you here. Okay, so I'll start covering what the different chapters have done. So you could see as the overview, so we have 19 active chapters. I know that there's some, faculty from different schools that hopefully will have a larger number by next year. We divide them by regions, so you could see the Midwest region, the Northeast, the Southeast, the Southwest, and the West region. Okay, and this is some of the activities that they have done. So the Midwest region, we have the University of Illinois in Chicago. So what they did is that they hosted a Practice Your Spanish counseling session, emphasizing the importance of Spanish skills in the pharmacy profession to be able to serve your patients, right? Even if you're not able to be, fully bilingual, but at least being able to connect and, just say, hey, ¿cómo estás? ¿Cuál es su nombre? Just kind of basic Spanish. I think it's really important to connect with those patients. The Northeast region, the John Fisher University. So they attended a health fair, and they were able, in that event, as you could see, they were able to do 33 blood pressure checks and then primarily serving the Hispanic community. Temple University, they also hosted an event, and they did a safe medication disposal event, so kind of a brown bag event. They're helping patients how to correctly dispose of their medications. Probably had a lot of expires that they were able to help them get rid of and then know how to safely dispose of them. For the Southeast region, the University of Georgia, they hosted an event during Hispanic Heritage Month. They collaborated with Walgreens, and they were able to give flu shots to the community. You could see that they gave around 200 flu shots at 2 of the events that they hosted. The Southwest region, the FEEC School of Pharmacy, hopefully I pronounced that right. This chapter, they hosted a canned food drive where they collected donations to provide meals for the San Antonio Food Bank. And then the University of North Texas, they hosted their general meeting where they welcomed guest speaker Laureen Wheeler from CVS Health to talk about internship, rotation, and postgraduate opportunities. Okay. The West region, and AJ could attest, you could see how they were impacted by the California wildfires, and then the West Regional Director, Dr. Yvonne Alba, provided screening and additional support, such as medication refills and medical supply access to people impacted by the fire. So you could see how, our students are having an impact on those communities. So Touro University, for El Día de los Muertos, they got together to teach about the cultural humility and sensitivity in pharmacy practice while discussing the importance of the Dia de los Muertos. And then Western University, during Hispanic Heritage Month, they also participated in a health fair, providing blood pressure, glucose screening, and BMI measurements, and chronic disease education. Okay, and then for the graduates, I don't know if we have any, but I'll just kind of show the slides of some of our students that just are graduating this year. So. Okay, so we have someone representing, so, and I think that we have, okay, I know, but if you want, I think we have some cords, right? Yeah, so maybe we could give you the cords that we have for the students. So. And then from Temple, you could see the students. Okay, and then I'm gonna present our keynote speaker, and then Liliana, I'm gonna need your help because I don't have your password. So Dr. Rafael Saenz, he's going to be our keynote speaker. I was super excited when I received the announcement that he was going to be the president, right, of NHMA. And when I saw the Pharm D, I'm like, oh, we have a pharmacist president of this. So as we were looking for our keynote speaker, we thought that you'll be the perfect person. So thank you for saying yes. So I'm going to try to read, it's a long bio, so I'm just going to try to, right, no, but just some of the highlights, because he's really impressive, right? So he serves as the executive director of the National Hispanic Medical Association in Washington, D.C., but prior to this, he had positions of chief operations officer and chief of staff at the American Pharmacists Association, so this is like coming back home for him. Throughout his career, Rafael has significantly contributed to the field of pharmacy, including roles such as Chief Pharmacy Officer at the University of Virginia Health System, Assistant Dean for the Virginia Commonwealth University School of Pharmacy, UVA Division, Program Director for the UVA Health System, Combined Master's Degree, Health System Pharmacy Administration, and Leadership Residency Program, and other leadership roles with the University of Pittsburgh Medical Center. Rafael earned his Doctor of Pharmacy degree from the Virginia Commonwealth University School of Pharmacy and his Master of Science in Health System Pharmacy Administration from the University of Wisconsin, where he also completed a combined residency master's degree program in Health System Pharmacy Administration at the University of Wisconsin Hospital and Clinics. So, thank you.
Thank you. Thanks for sitting through that. You will not offend me at all if you make your way to the bar and just drink merrily while I talk. Look, I'm not going to bury the lead. I'm going to repeat everything Dr. Serrano said. The best and most important and immediate way for you to make an impact is to join and be active in the Hispanic Pharmacists Association. Right? So don't leave without talking to a board member. Board members, raise your hand, right? If you get involved, that's the best way to make an impact on our community. So let me put my speaker hat back on. I do want to thank Dr. Serrano for the invite. I want to thank NHPA for the invite. You have to forgive me. I have all these letters going through my head, NHMA, NHPA, APHA, and so it gets bumbled up in my head. And then it's in Spanish and I got it translated, so it's but I wanted to thank also, because I am an association professional now, all the sponsors right? We couldn't do this without you. And we notice, okay, just so you know, we notice. We saw your logos up there. We thank you. We take notice. And you know, I think this is efforts that are well spent in promoting the health and well-being of our community. So a little bit about NHMA. NHMA, right, and PHA, we have the same roots, right? We're no longer business partners, but we're still part of the same familia, okay? So we are all intertwined. Even if you look at our mission is pretty much the same as your mission, okay? And it's to empower, in our case, Hispanic physicians to lead efforts to improve the health of Hispanic and other underserved populations. I want to stress that because we can't do it alone. We need each other. And so everything that I'm going to say, I'm going to talk to you from the aspect of NHMA, who is my employer now, and whose mission I strongly believe in. But I want you to know that I'm always going to be a pharmacist. At my very core, that's who I am, and it's how I live life, through the lens of a pharmacist. And I just happen to work for a medical association. So you heard a little bit about me. I'm not going to harp too much on this, but I have been getting one question a lot lately. What's it like being a pharmacist running a medical association, right? So in order for me to tell you that, I have to kind of tell you a little bit of a story. In 1987, I don't know how many of you are here from Texas. I'm a Texas native. In 1987, my father, by the way, he was 66 years old when I was born. We went to HEB. Y'all know what HEB is, right? So sorry if they're a competitor, sorry. But my dad had just undergone bypass surgery, and he went to get his medications filled. And the pharmacist was not a Spanish speaker. My dad was looking at me like, you know, ¿qué está diciendo? You know, like he was like, what is he saying? And I was 12 years old, right? Like, I didn't know. I don't know those words. He said to take one every day. And what about this one? He said to take that one every day too. Well, what about this one? He said to take that one too. Wait, was it this one or that one? I don't know, right? That's the day I decided to become a pharmacist. I'm going to tell you that's the day I remember thinking to myself, there's got to be a better way. I have to do this. And so just like you, just like President Serrano mentioned earlier, like my mom was a field worker. My dad was a small business guy. He had several different businesses throughout his career. He was a cobbler. He was he owned a tiendita, right? Like there was no college. There was no prospect of college. It was just, hey, buena suerte, mijo, you know, no sueñes, right? I hear that a lot, no sueñes, right? Find somebody, get married, you know, vas a estar bien. And so that's how I live life. And then I remember when this pharmacist and my dad had that disconnect, I remember thinking, all it takes is just me to learn some words and learn how these medications work. And so I studied, I went to school, and as I told my board now when I interviewed, I was like, well, I applied to Baylor University and I applied to the University of Houston. Whichever one gave me the scholarship is the one I was either going to be a physician or I was going to be a pharmacist. Either way, I was going to make it happen. University of Houston was cheaper, and they came in with a full scholarship, so that's where I went. You know, but again, you know, I keep telling people, you cannot take a small-town rural Latino and put them in Houston, Texas, and expect them to thrive. Like without some guardrails, without some discipline, it threw my world apart. Right? I lost my scholarship. I didn't know how to study. I didn't understand why I was so behind. It wasn't until later that I looked at school district rankings and I realized, oh man, I was way behind. So all it took was just some concerted efforts, somebody to take an interest in me and invest in me as an individual, and I began to thrive. Right? Luckily, I met my then fiance, now my wife of 25 years. And she transferred to University of Virginia for law school, and I came with her, and I transferred from Houston to VCU. And that's how I got my start. And then from there, I realized it's not just about learning, It's about willing to be open to new opportunities. So, I'm from a small town. We like to know who we're working with. We like to not have a lot of change. So I went to school, and I remember thinking, if I'm going to be here among all these people, by the way, only Latino in my class, in Virginia, Richmond, Virginia, it's not a surprise, right? But I went to school, and I'm thinking, if I'm going to be here, I'm going to make it count. I joined APHA. Okay? I always tell people APHA was my first professional love. It was the thing that I did first. I was ASP president, and I was regional president, and I was all about APHA, and that's got me hooked into providing and doing more for the profession. Then somebody said, hey, you should be a compounding pharmacist. So I wanted to be a compounding. I don't know how many of you are old enough here when compounding was an all-cash business, and people who did compounding pharmacy had safaris, that they went on vacation, they had Ferraris outside. And then I was like, okay, I'm going to be a compounding pharmacist. And then the director of pharmacy at the hospital I worked at came out one day and said, hey, who wants Redskin tickets? And I was like, hey, maybe I should be a director of pharmacy. They get all the good stuff. That was before pharma rules and all that stuff, yeah. Way to take that away, all right? So then somebody pulled me aside and said, have you ever thought about administration as a specialty in the profession? And it was just that interaction. Somebody taking interest in me, noticing me, and now that I'm up here, I can tell you very confidently, I have lived a charmed career. So I list all these things here, not to brag, but to tell you, each one of them had a unique thing. And my talk to you today was going to be about reinvention, right? So I went to residency, and residency, they taught me how to solve problems, right? That's what residencies do. They help you how to solve problems. Then I went to work for my first boss, who, by the way, was a guy who pulled me aside and asked me if I was, interested in administration. And he said, hey, I need you to build me a technician training program. An in-house, in a hospital. There are very few of those. And this was early 2000s. And I said, okay, sure, I'll try that. And I did it. Then, 6 months later, he was like, hey, I need you to redesign our practice model. And I was like, well, that's a big stretch from technician training program to, oh yeah, let's deploy pharmacists to the units in a 1,200-bed academic medical center. All right, let's do that. Saying yes really, really helped me understand the business of pharmacy, the relationships that you have to build in pharmacy, nursing, physicians, et cetera. It's how I began working interdisciplinary. Then one day, after we deployed over 80 pharmacists to the units, he said, hey, can you fix our ambulatory areas? Sure, I'll try. It was my first foray into 340B, into weight rooms. So another thing I should tell you is, in Wisconsin, my master's degree is not a regular master's degree. It's half business, half industrial engineering. So I'm all about process design and Lean Six Sigma, things like that. So we did it with wait times, right? So we had over a 2-hour wait time in our flagship pharmacy, brought it down to about 30 minutes or so. Not bad for our first foray. But then one day he comes to me and says, how'd you like to live and work in Italy? And I was like, come on, man. You're messing with me. UPMC happens to run several hospitals in the European theater. So my job was to live and work in Palermo, Sicily. Now, I don't know how many of you have ever spent any time in Palermo. I joke that they are very much like Hispanic people of Europe. And so we click. They're close with their family. Nothing comes between them and their family time. They're all about the food. They're all about community. And so I found a kinship with them. I mean, I was there. I felt like I was home. And the thing is, it was a universal payment model, right? Pharmacists had way fewer authorities than we have here in the United States. So it was completely, literally foreign to me. But I said yes, and I went, and I learned how they work. And one thing that I realized is that their patients have a lot fewer hesitancies. Right? We're talking about vaccine hesitancies. We talk about vaccine issues and people not getting the vaccinations. In a single-payer system, where a patient has access and can afford, or because they don't have to pay anything out of pocket, for their medications, they trust the person who's in front of them, the medical professional. If you feel like this is something I should do, absolutely, I'll do it. I've seen it firsthand, right? These folks are not any wealthier or any poorer than anybody in the United States. They just have access and they have information. Okay? To me, that was monumental. I had the opportunity to become an expat and stay in Italy, and my wife one day says, hey, yeah, you're going to be a dad. So I couldn't become a father while my mother was in the United States. She would never forgive me. So I moved back and took a job at the University of Virginia. Again, I was there 3 months, and the chief pharmacy officer left, and everybody kind of looked at me and they're like, you're it. And then again, an opportunity to say no or say yes. You say yes to those opportunities. Did that. Decided I needed to go do something different. APHA had an open position. Luckily, I was able to apply for it, and I was there. Learned so much about the association space, but I also began to understand more. Now, all this time, was the only Latino everywhere I went. Okay, I just want to make that clear, because then when I came to APHA, I was like, where is everybody? Where is the Hispanic academy? Where is the Hispanic pharmacist? Where is everybody? And it was Magali and me. and so I remember thinking, this has to change. There has to be more. Latinos will make up 25% of the population of the United States by 2030. But yet, physicians only make up about 6% of the workforce. Pharmacists, 5.4% of the pharmacist workforce is Hispanic. So that means other non-Hispanic providers are caring for our population. That's not a bad thing. The problem is, it creates some barriers. And so we have to help them. We have to make sure that the barriers are addressed. And I've told you all that to tell you that it starts by saying yes. And going back to my beginning statement, say yes to the board members who are around the room and participate with the Hispanic Pharmacists Association. So in terms of being a pharmacist and change, how many of you in here have thought over the last year, and there's no shame, todos somos familia, have thought, pharmacy is not for me, there's too much going on, I cannot be a pharmacist anymore. Come on. Nobody here has thought about leaving pharmacy in the past year? It is remarkable. When I talk to pharmacists, that's the first thing they tell me. It's like, hey, what do I do? Can I do something different? You either have people in community making the transition into hospitals, or you have people in hospitals saying, let's go do industry. Or you have people in other parts of the profession saying, I just want to leave it altogether. I could go to real estate, right? How many pharmapreneurs do we know? There's a lot of pharmacy entrepreneurs that are wanting to do something else. Here's the thing. Pharmacy is a beautiful, beautiful profession. I love it. Some of the things that I wanted to talk to you about are the common issues that affect us, right? Workload, workforces, all this stuff, right? Where's the respect? We don't get respect from the docs that we get. There are a certain amount of things you can do. In my professional and personal opinion, it's about reinvention. It's about discovering the profession in a different way. So I was a hospital guy, and I've lived my whole career in a hospital up until 2020, and the CEO of APHA called and said, hey, we're looking for a COO. Are you interested? I didn't know anything about association management at the time. But I said yes, and I tried it. And I realized that there is so much that pharmacists can do and need to be successful in not just in their career, but in life. And I think that's what the National Hispanic Pharmacists Association tries to do, and I think that's what APHA tries to do, is to provide you with those tools and resources to be successful. But a lot of times pharmacists say, well, I don't know how to get started. Well, I know a lot of pharmacists who are taking master's degree programs or getting a dual degree at the same time as they're working. I know it's hard because you're working full time. You don't know what your schedule is. You have a lot of workloads. I get it. You have to have faith in yourself and have the right opportunity. So why does it matter? Why does reinvention matter quite a bit? There's been about 2 or 3 times in my career where I have felt burnt out. And if you haven't guessed it, yeah, in 2020, when I left UVA, that was my burnout. I mean, I burnt out. I was in a hospital. I was looking at our 340B program. I was looking at our safety measures. I was looking at everything that pharmacy directors are required to, keep monitoring of. I remember thinking, I can't do this anymore. Like, I cannot go one more minute doing this. And I was like younger than I am now back then. Burnout happens to everybody. You have to know when to call it quits. It's not quitting. Right? There's a TV show. Do y'all know Star Trek: The Next Generation? For those of you who are as old as I am. There's a famous quote on it. It says, you can do everything right and still lose. It's not failure. That's life, right? I had done everything right, but I felt like I was losing. I felt like I was failing. And it was just because I had burnt out. There was just no more fight, right? So when I made the transition, again, I became an entrepreneur. I became the CEO of my own consulting firm, and it was wonderful. It was great. I was working for myself, making more money than I ever have. And then COVID hit. And then all the contracts started to go away, right? And so I was thinking to myself, what am I going to do? Go back in the hospital and continue the same process, or do I pursue this APHA opportunity? Because it's something different and something that I think I can be good at. And that, in and of itself, invigorated me. It kept me going. And there's no time like the present. So if you are thinking about taking a step, if you're thinking right now about, maybe I should try this, maybe I should do that, I'm telling you, I'm giving you permission. Do it. Right? And then call me, see how it goes. I guarantee you'll be fine. So why did I go to NHMA? And that's the number one question I've been getting. I have for some time been thinking back to my own life and been thinking, what would I have done differently? What would I have said to myself, my 17, 16-year-old self? And it's what I told myself that made me change my career path. There was nobody running me out the door at APHA. I think we had a pretty good relationship, right, Magali? So it was just a matter of, I just decided one day that I wasn't contributing in the way I wanted to contribute to my community. This position came up, and I thought, this is maybe not working directly with Hispanic communities, but it is community-focused. The one major thing that I will say that I've learned at NHMA that I maybe didn't think about at APHA is that the way physicians think is a lot different for a couple different reasons. One, they don't worry about things like provider status. They're like, provider status, what are you talking about? Like, we are the providers. They don't worry about reimbursement models, right? There's no such thing. And they don't worry about advanced practice models either. So our conference is coming up in June, and I asked them, where's the advanced practice model showcase? What are we doing to showcase advanced practice models? And I got this look like, what do you mean? Like, we already talked to the patient. Are you talking about AI? We don't want to put AI between us and the patient. What are you talking about? I was like, So you guys just talk to the patient? Like, yeah, we want to do more of that. Is that what you're talking about? How do we do more of that? I was like, yeah, sort of. So again, having them, the other thing I learned, and this is something really cool that I'd love to work with you guys on, they don't really actually quite know what pharmacists do, right? So some of you who work in hospitals or academic medical centers, you're probably like, I work with my physician all the time. They know exactly what I do. Yeah, they know what you do for the patients in the hospital. What do you do for the patients at home? For those of you who work in like federally qualified health centers or even in the community pharmacy setting, do you think the docs that write you prescriptions know what you do exactly? Right? So that's the problem. How do we care for our communities when physicians don't know how to utilize pharmacists? Right? I've said it before, I said it again. The number one threat to health system pharmacy is C-suite leaders who don't know how to manage pharmacy. Number one threat to the profession of pharmacy is society not knowing what pharmacists do or can do. Okay? So when we care for our community, there are some real barriers. In addition to us not being en masse in society to care for patients, right? A lot of us also don't know Spanish. And I'll tell you, my dad refused to go to seek care because he didn't want to have to deal with people. Basically people who didn't speak his language. And that was a barrier to care. I didn't realize it back then. I just felt he was being a little racist, right? But because he would say things like, I don't want to go see that guy. And I just was like, okay. But I guess I realized later that he was just embarrassed. He didn't want to go to the doctor and then, not speak English. So he just didn't go. Education, not just in terms of the education that our people have, but the way we educate our patients is also an issue. So you can't talk to just everybody, with this, college level, like using all the cardiology and all the medical terms. Sometimes you have to just speak plain, just be straightforward. And if we have a community that is healthy, the whole country is healthy. Because not only do we make up a significant amount, but a lot of times Latinos work in those industries that keep the country going. So having healthy Latino population means a healthy country. So you all get the point. The role of pharmacists in care of our community is important. One of the things that I always tell people, and you know these things, right? Here's the other issue. If you are a person of Latino or Hispanic heritage, in our current climate, you probably want to not draw too much attention to yourself. I hate that I'm even saying that into a microphone, but it's the nature of the world. But they will go to a pharmacy, right? However, think about our practice models. If you're in a community setting, you're still behind the counter, those drugs still have to be secure, right? A lot of times they're not gonna go up to the counter. They're not gonna talk to you. It's okay to come out. And I know it's hard because you have metrics to fill, you have the process of pharmacy filling prescriptions to do. But the truth is, when you talk to Latino people, and I am one, they see pharmacists as a more approachable, more humble profession that they can relate to. And that's just the truth, right? So there's other barriers to care for the Latino community. So in addition to that, the payment models are different, right? A lot of times they don't have insurance. And so what will happen is you're going to give them the UNC or you're going to give them a price for their prescription. They are going to balk at that. And they're just going to say, no, thanks. I guess I'll just go without, right? That's a problem. You need to go to the patient. So how do you do that? You have chapters all over the country. NHMA has chapters all over the country. One of the things that we do is we put on health fairs all over the country. Each of our chapters have at least two health fairs a year. I think there's an opportunity here to partner, especially for those students in the room, right? If you have a student chapter, students are wonderful for community outreach. Let's partner on all of these things, right? And you need to make sure you're seen and heard in your communities. How many of you are active in your civil boards, educational boards, PTAs, all that stuff? Right? Right. I hope more of you think about getting involved at that level. Because again, pharmacists have the ability to not just solve problems, but convey information in a way that the average American will understand. So, I know I'm running out of time. I apologize. I always want to do a call to action to practitioners. Okay? Keep an eye out. Mantente ojo, right? Keep an eye out. If you're in your pharmacy, look out. You'll always see somebody who's struggling with something. You know that, right? Like you've seen it. I've worked behind the counter too. I can always tell when somebody needs help with an over-the-counter product. I can always tell when somebody has questions that they just are afraid to ask, right? And here's the other thing. Most vaccine-hesitant people don't really know that they're vaccine hesitant. They just know that nobody's ever offered me one. Talk to them about what it means to get a vaccine. We recently held a town hall on measles, okay? Again, something I'm talking into a microphone saying in 2025. We had a town hall about a measles outbreak in Texas. And the physicians who were talking were saying, here's the thing. It had almost become not a thing, in the United States that people stopped talking about measles and we were just vaccinating people. And then all of a sudden people stopped wanting to get vaccinated. And then there was adults who are having questions about, well, should I get measles vaccines? Well, yeah, you should, but not just get one, like get a titer and make sure that you need one. People don't know that. People were coming up to pharmacies and saying, I think my kid has a vaccine, but I'm not sure that I do. How do I do that? And am I too late? So addressing all these concerns, right, for all age levels in a way people can understand, in a language they understand, is how you start making a difference. Engage, I'm going to say this again, engage in professional organizations, advocate, model the behavior for your students, okay? And partner with physicians. For those of you who are in community practice, do you have a personal working, maybe collaborative practice agreement with anybody in your community? Okay. For those of you that can and work in states that allow it, I highly encourage you to do that if your employer allows, right? Because the thing is, in order for us to make a difference, there has to be that physician-pharmacist-patient relationship. More than ever now, I'm seeing the importance of all that. I used to think as a pharmacist, like, well, that's all I need. I'm a pharmacist. I know what I'm talking about. But the truth is, patients do listen to their physicians way more than they listen to anybody else. And so that, if you are more accessible and you have a direct tie back to that physician, then you really can't lose that patient. Students, okay? I don't know how many students we have in the room, but I would love to see this room packed with students next year. Packed. There's so many implications to that, right? So one, we need more Latino Hispanic pharmacists. We need more Latino Hispanic physicians, right? We need them to be involved here at this meeting, in this group. Okay. The students have the ability, because they have the time, to go and put on community health fairs, partner with others to put on community health fairs. Students can take the word to the community. So I don't know if we have students in the room, but I would encourage you, maybe perhaps call a charge for the National Hispanic Pharmacists Association to issue a project for students to go into the community. Good. Again, learning basic Spanish. Lift as you climb. Okay? It's important that if you are able to get into school, reach back out to your high school. Hey, can I talk to my old classmates about what it's like to be a pharmacist? Right? All of you are, I don't know if you all are part of your high school alumni groups or whatever, or if you keep in touch. That's an easy way. Hey, I'm a pharmacist. We're looking to spread pharmacy as a career. Can I go do a health fair with you guys, or a career day? Okay, you'll be surprised at how gratifying that feels. All right. Just a little bit about NHMA. Of course, we do a variety of different services for our community and for our members. And if you have any ideas or thoughts on how we can collaborate, here's all of our contact information. If you have any questions from me directly, it's just rsaenz, like R-S-A-E-N-Z, at nhmamd.org. And I'm happy to share that with President Serrano, and she can share it with you guys. But that's what I have for you today. Participate, get involved, say yes. Thank you.
Okay, I will keep this brief, but thank you so much, Dr. Saenz, on that message. Totally resonated with me myself. I went to pharmacy school when I first went in to USC, fight on, by the way. When I first went there, I thought for sure I was just going to come out and just work and, live my life. No way did I expect to, deter and go into emergency medicine, and then now be in oncology, and now as the director of pharmacy for City of Hope National Medical Center. But most importantly, as the president of NHPA, this is what really makes me happy. So to find, those opportunities and say yes to them will really get you to, tapping into what makes you happy. And then not just saying yes, but knowing that you could challenge yourself to maybe extend into something different. So just as Dr. Saenz was saying, being able to reach out and challenge yourself. I look forward to meeting every one of you in a few minutes as we mingle around. But I do want to just say thank you so much to Lily, as well as Guillermo, for putting on and having this as a flawless event. Thank you so much. So I hope you had a great evening, and I hope to meet all of you soon.